schools finalize their reopening plans, DHEC is encouraging parents to make sure their child is up to date with all recommended vaccines. News 19's Whitney Sullivan talked with the doctor about how parents can prepare kids for the new school year and cold and flu season during a pandemic.
Many children and parents are understandably anxious about the upcoming school year. From vaccines to going to the doctor's office to get a physical, families have concerns because of COVID-19. To help ease your mind, I took some of those concerns and questions to Dr. Caroline Weber, a pediatrician with Lexington Pediatric Practice. First question, is it safe for children to get immunizations?
Definitely, and there are some vaccines that are still required for children to have to go to school.
Dr. Weber says they've actually seen a decline in child vaccination coverage.
We unfortunately have seen that when the COVID-19 pandemic started and children began to miss some of their well visits, we've already noticed a decline in vaccination rates. And so it's really important, especially heading back into school, that children have what they need to help stay protected from some of those vaccine preventable illnesses.
It's not just a trend here. The CDC says fewer childhood vaccines have been given during the pandemic. And speaking of vaccines, is the flu vaccine safe for children?
It's especially important, maybe even potentially more important this year for children to get their flu vaccine, because we know that at least that's one illness we can have some impact on decreasing the rate of.
Next question, should parents be concerned about taking their kids to a doctor's office during this pandemic?
I would reassure families that there's a lot of safety measures put in place so that you can feel comfortable coming into the office for vaccinations, well visits. Sports physicals are another thing that's been necessary this time of year, that you can feel comfortable doing that because of multiple measures that were taking place, including extra cleaning, physically separating sick and well patients, and different appointment times for those different populations as well.
And we'll wrap things up with one of the most popular questions Dr. Weber says she gets. Should children take multivitamins?
If your child is otherwise healthy and eating a normal, pretty balanced diet, then a multivitamin is not necessarily recommended.
For Speaking of Health, I'm Whitney Sullivan.
Well, Dr. Weber says this is also a good time to reassure your child that while school may not look or feel normal, they are just different safety measures that are put in place to help protect them, their families, and their teachers.